are joining us, particularly joining us for the first time. My name is Cindy Duke. I am Dr. Cindy Duke, Medical Director and Laboratory Director of the Nevada Fertility Institute here in Las Vegas, Nevada. I'm certainly giving today's presentation off of my professional Facebook page, but this is also being live streamed across the Nevada Fertility Institute Facebook page, as well as being live streamed on the Trinidad and Tobago Center for Comprehensive Women's Health page. So that's who I am, Dr. Cindy Duke. I'm here today really to talk about coronavirus, in part because there's been so much media coverage. I think for a lot of us, we're probably feeling overwhelmed. We're probably feeling a sense of mild despair over how do we really parse through this information. Am I at risk? Am I not at risk? Why are some people saying coronavirus while others are saying COVID-19? And then more specifically today, for my patients who are either still trying to get pregnant or have recently become pregnant, I know a lot of what we're hearing seems unclear as to whether or not we can apply it. So that's what we're going to talk about today. We're going to talk about coronavirus, COVID-19, why they're used differently and when each term applies, how you can avoid infection, and ideally the whole goal of avoiding infection is to, one, help yourself, but also then to decrease spread of said infection. And so it's really important that we talk about that. So first things first is coronavirus. What is it? Well, like the name suggests, it's a virus, meaning it's not a bacteria. It's not a disease in and of itself. It's actually something that is not alive. It's a particle that contains DNA and proteins that are packaged into a very special design that can then, when it enters your body, it can invade the cells in your body and then cause your body's own cells to start making more of the virus. And so that's how viruses work. They need to get into your body. They need to get into cells to actually create themselves and replicate and spread. And so you are essentially the host. You become the body that it replicates in. And then you are the vector if you're not careful, because you would then go on to spread it to other people who then become hosts. So coronavirus is a virus that can cause an infection. Not everyone who gets the infection will have symptoms. We'll talk about symptoms in a little bit, but not everyone who gets the infection will have symptoms. And so most people may become exposed, infected, and not know. And so that's why one of the things we're going to talk about is how do you decrease your chance of becoming exposed, first of all, and thus decreasing that chance of you becoming infected and later spreading it even when you don't have symptoms. And that's really one of the key things I want everyone to take away from today's conversation is do not walk away thinking that because you don't have symptoms, you are not infected. They're not one and the same, okay? People who go on to have symptoms and develop an actual disease process that lands them, say, in the hospital, etc., are the people who develop the disease that comes from the infection if it were to progress. And that disease, of course, is COVID-19. So someone can be infected with coronavirus, not have the disease COVID-19. And so that's why it's important to really distinguish the two. So that's why we talk about coronavirus. We're talking about decreasing the spread of coronavirus, but what we're really also trying to avoid is having people develop COVID-19 disease. And so that's really the crux of today's conversation is coronavirus and COVID-19. But the first half of my talk today in our discussion is talking to you about how do you avoid the coronavirus infection if you can, and if you are infected, how do you decrease the spread of the virus. And so you've all probably seen the memes, heard the talks, heard the advertisements, certainly seen the panic that is ensuing, unfortunately, from all the people who are hearing the stories of how badly this could go and running out to purchase supplies, etc. And part of this is why I'm giving this presentation, because there is reason to be prepared. But we also need to try to minimize panic, because panic is when things can actually go awry. It's when misinformation spreads, and certainly when people start acting untoward and not in their own safety, and certainly not in the interest of others when they're not being safe. So coronavirus, like I said, it can cause an infection. Not everyone will actually display symptoms when they get infected. But if someone were to have symptoms, common symptoms, based on the information received from all of the patients in primarily at this point China, but also what we're seeing across the globe, is the symptoms can range from a cough, mild to high fevers. And so you can have temperatures somewhere in the order of 100.5 degrees Fahrenheit, which would be the equivalent of about 38 degrees centigrade if you're using centigrade. And so you can have intermittent fevers though. So the fevers come and they go. For some people, it starts with that. They may have a sore throat. Some people may have signs of what you might call the common cold. So runny nose, some congestion. You may also then start feeling some chest tightness, shortness of breath. Those are all symptoms. One of the things that I learned today as well while listening into a phone call with the Centers for Disease Control, the CDC, is that in some people, particularly in younger children, you might actually see more of a gastrointestinal illness. So you may see some diarrhea, some nausea, some vomiting, although that is not the primary or the most common way that children might present with an infection, but you do see that in some of them. But primarily it's respiratory, and it can range from someone feeling a mild sore throat to some temperature changes, feeling hot when other people are feeling cold or normal, chills coming and going. But as you probably can guess, a lot of those symptoms that I'm describing there are very nonspecific. If you had a regular cold, you might feel that. If you were coming down with allergies, you might feel some of that. And so the preponderance of caution right now is, if you're not sure, contact your healthcare provider. But again, to emphasize, the vast majority of people who are infected may not display symptoms. And so you should in no way just feel reassured because you have no symptoms. If you've been exposed, you should actually follow some self-quarantine precautions, and that includes, if you think you've been exposed, meaning if you were around someone who later went on to be diagnosed with coronavirus infection or COVID-19 disease, you should then go on to practice hygiene, isolate yourself. So that's called social distancing, and it's really meant to try to decrease the risk of you transmitting it even though you're not feeling sick. Public health specialists and experts are doing a wonderful job at implementing programs that can help them track and source infections, meaning if someone tested positive, they will then go back and follow through their contacts to see if they can index, as we call it, all the people that they would have contacted or been in contact with, or who might have been in their general space and been exposed. Certainly, if you're having questions, feel free to leave them here. I will come back to them as we work our way through the live today. So those are the key things to remember. First of all is that there's a virus. It can infect your body, meaning it gets into your body, takes over some of the cells in your body, which in turn makes more virus. You may not be feeling symptoms, but you're making virus, and therefore you might be shedding virus. The virus tends to shed in what we call droplets. So, for example, if you sneeze, whether you know it or not, if you sneeze, an actual mist of air comes out. When you cough, a mist of air with small droplets droplets such as, sputum, spittle droplets come out, and the virus will be in those particles. Those droplets in turn can, if you coughed into your hands, it gets on your hand. If you coughed onto your clothes, wherever, it can get there. If you're talking and something fell out, it can stick to things. If you're using your phone, some of that droplet can land there. And so it can land in places without you knowing, meaning you could be shedding the virus without knowing, especially if it's during that time where you're one of those people who either has not yet developed symptoms, or you're one of the people who doesn't ever develop symptoms, because for the vast majority of people, they won't develop symptoms. So that's the first thing I wanted to really talk about here, because I think there's a lot of a false sense of security amongst many people when they hear this story, because the assumption is only those who have symptoms can spread it, and that is not entirely correct. Now, if you have symptoms, that is something where we start getting concerned, not only for the symptoms, but could you go on to develop the disease, COVID-19. So certainly, if you're someone who's having symptoms, or you are a caregiver for someone who has symptoms, you should certainly reach out to their healthcare provider as soon as possible. What we do know about COVID-19 is that it can progress very quickly, particularly in patients who are at high risk for progression. And I'll tell you who those people are in a bit. But if you're someone with symptoms, the first thing you should do, or if you're a caregiver of someone who's displaying symptoms, even if you're not sure, even if you're thinking, there's no way this person could have been exposed, they haven't traveled, they've only been here in our local area. You can't be sure, because like I said, there are people who could be shedding the virus asymptomatically. And so it could even be you, the caregiver. So the first thing is to contact your healthcare provider. Now, by contact, I don't mean jumping in the car and racing to your healthcare provider's office. I would say the first step, if the person is displaying symptoms but stable, meaning if they're not short of breath, having difficulty breathing, etc., is get on the phone, call your clinic, and explain what's going on. For most of us, if you're within the United States of America and you have health insurance, most health insurances have telemedicine coverage. You can actually even call the telemedicine doctor or telemedicine line for a triage or an evaluation. And there, they'll help you figure out whether or not you needed to go to the doctor's office, whether you can be managed from home, or whether you or the person you're caring for needs to be taken to the hospital emergency room or urgent care. So that's the first thing I wanted to emphasize, is use your ability to call either your telemedicine provider or the triage line, contact line, after hours line to ask for help. If you're someone who's uninsured, and I know here in the state of Nevada, for example, here in Las Vegas, you can call the Southern Nevada Health District, and they also have things in place for helping if you're uninsured. But the first thing you should do is contact your local health provider. If you're looking at this from Trinidad and Tobago, the same thing. You can contact your health provider. You can certainly contact the Trinidad and Tobago Center for Comprehensive Women's Health. They have an established telemedicine virtual clinic set up that you can utilize as well. So that's the first thing to know about what to do if you think you or your loved one may have symptoms. Don't rush to the doctor's office, because that's how you can actually end up spreading things to other people, particularly others who may be at risk. If you are having symptoms but they're not life-threatening, and by life-threatening I mean if you think, oh my gosh, I can't breathe, if you're having trouble staying conscious or feeling like you can stay upright, then that's more serious. Please understand what I'm saying. But if you're having symptoms, that's what you should do. Now, who are the people who are high risk? Because the whole goal of what we're doing right now, which is called containment, is because we're trying to prevent infection from the people who are high risk, right? And so even though I may be healthy, even though I may have been infected but not having symptoms, and so I'm going to recover and be fine, the worry is the person who, when I say am, that's the figurative am, I do not have the infection. But if someone is infected, right, and they don't realize, and they're out there shopping, supermarket, touching things, coughing, just everywhere, they can spread this to people who actually are more vulnerable, people who are what we call high risk for going on to develop COVID-19, and those who are particularly at high risk for developing the worst form of COVID-19, which is what we call ARDS, Apple, Robert, David, Sam, ARDS, or acute respiratory distress syndrome, wherein the lungs become so diseased that they're not able to really work very well on their own, and these people end up in the intensive care unit requiring a ventilator to help them breathe. And of course, if someone's on a ventilator, it then becomes tricky because not everyone might get off a ventilator, and it can also put a lot of strain on the heart, which if it's working very hard and someone who maybe already doesn't have a very strong cardiovascular heart system, it can stop working. So the whole goal here is to protect those people. We're protecting those people who are at high risk for developing COVID-19, particularly the worst type of COVID-19 disease, which is acute respiratory distress syndrome requiring hospitalization and intensive care unit admission. Now, so who is high risk? Like I said, so people who have underlying disease, you've probably heard that, underlying disease, and you're probably wondering, what exactly is underlying disease? Does that mean if I've been told I have high cholesterol, I'm at high risk? Or does it mean that if I've had gout, I'm at high risk? Well, underlying disease is one, but then there are layers, right? So one of the groups that we're especially worried about are patients who have what we call immunocompromised states, meaning patients for whom the immune system may not be working at its optimal best. And for some patients, that's because of diseases like autoimmune disease and things that actually cause the immune system to be dysfunctional. But there are also patients who are on medications that have now compromised their immune system, meaning it's not working at its exact normal state. And so they're also usually not able to respond to infections, particularly infections such as certain viruses, as well as you, someone who is otherwise healthy, might be able to respond. And so immunocompromised, like I said, can include people with autoimmune diseases that are not well controlled, those who are well controlled but being controlled by, say, chronic steroids, so those who need to be on steroids to help control their disease. Patients with diabetes, particularly those whose diabetes are not very well controlled, are at risk. Those who perhaps have had a transplant. So if someone's had a kidney transplant or heart transplant, there are lots of transplants now, which is a good thing. We have that technology, and medically we've advanced to a place where we can do that. But for many patients, in order to keep their transplant working, they are on medications to prevent their own immune system from attacking the transplant. And so these are patients like that. Patients who are, for example, on dialysis, kidney disease, end-stage renal disease, they're at increased risk because the immune system is functioning differently. Patients with HIV/AIDS, particularly those who are either recovering from AIDS, undiagnosed, or if their treatment for their HIV is suboptimal, they may be immunocompromised. So these are the people we're talking about, people who are on chemotherapy. Their immune system is being manipulated, regulated to help them beat the cancer. But in turn, it may not be very good at helping them recognize the disease. Patients with sarcoidosis, lupus, rheumatoid arthritis, these are all patients who have autoimmune diseases which can alter their immune system. And so I'm not saying this to be alarmist, it's more to give you a sense of who is high risk. People with lung disease, and that includes people who have a history of asthma, particularly if you're someone with asthma who's needed to be hospitalized in the past. You should take this seriously. And if you're having symptoms, contact your doctor. Don't minimize it. If you're someone with chronic obstructive pulmonary disease, or COPD, that's another group of patients for whom they should be concerned. And if you're a caregiver for such a patient, take it seriously. If you're a family member sharing a house, dwelling space, meeting space with such a person, take it seriously. Likewise, if you are a smoker, so a chronic smoker, particularly someone who perhaps smokes as much as a pack a day or more, then there are changes that happens in the immune environment within your lungs. You should take this seriously, okay? I'm not going to use this as an opportunity to talk about why you should quit smoking. This is more to tell you, if you are a smoker, you know yourself, then take this seriously, take precautions. And we'll end this with the precautions today, so don't worry, we'll get to that. The first thing is really helping people understand coronavirus infection, and then COVID-19, and why we're trying to prevent coronavirus infection to help the people who are at highest risk of becoming patients afflicted with COVID-19 disease. And so I hope this is helpful. If anything's unclear, do please write something for me so I can know. But the goal here is to really clarify and to encourage people to take this seriously and to spread the correct information out there. Now, there are a lot of very reassuring things that we know about coronavirus infection and COVID-19. Like I said, the vast majority of people, if infected, will recover, will have at worst mild symptoms, which is the coughing, the shortness of breath, not so much, but the coughing, the runny nose, the sore throat, feeling sort of lethargic or malaise. You just don't feel yourself, not as energetic. The majority of us who are healthy without that underlying disease will recover without any intervention, no hospitalization, etc. But what that majority, need to be aware of is it is our duty to help prevent ourselves from getting infected so that we can protect the people who are at high risk for developing COVID-19 disease. So think of this as not just self-preservation, but really we're relying on ourselves and the community at large to help us protect those of us whose bodies may not be able to fight off this infection in the way that it should, because their body is otherwise altered as it helps to fight off some other disease that they've been coping with for a while. Now, coming to pregnancy, and the same thing goes for pregnancy here. So when I talk about pregnancy and risk of COVID-19 disease in a pregnant patient, the ones we worry about first and foremost are the ones with those underlying disease. And so if you're a pregnant person who has underlying autoimmune disease, diabetes, or gestational diabetes, if you've had a transplant, I certainly have a few patients who've had transplants, bone marrow transplant, etc., then you're definitely someone who should take these symptoms seriously and reach out to your doctor. If you're pregnant, if you're in the second or third trimester, you should have an obstetrician, particularly if you have those underlying disease. Even if we were not talking about coronavirus today or COVID-19, you should be seeing a doctor. You should be seeing your physician. You should be having very regular and close follow-up, because these are the OB patients in particular that are at risk. So with COVID-19, now the risk is greater that we have to protect you. Pregnancy in and of itself can sometimes render women at increased risk for infections and diseases of certain types. Not everybody. And so this isn't meant to scare pregnant women, but it certainly is. If you have underlying disease, you should know that it's important that if you have underlying disease, you should be in touch with your clinic, in touch with your doctor. If you're at home not feeling well, you should at least call that triage line. It's okay to call, ask some questions, get screened, figure out what's the plan if you were to develop symptoms. Where should I go? who should I call? And that's important. It's good to have a plan. Those who know me, those who are my patients, particularly my high-risk patients, they know that to me, the most important thing in planning pregnancy and going through their pregnancy is the plan. It's having a plan beforehand and a few plan A's and plan B's and even plan C's so that you're prepared. So those are the key things. So what we know about COVID-19 and coronavirus with regard to pregnancy and trying to get pregnant. Well, let me tell you all of the exciting, reassuring things we know so far. To date, we do not see any evidence. Mind you, as you probably saw from my earlier share on Facebook this morning from the CDC, we do not see current evidence that a pregnant woman, if she became infected, that the virus then goes on to infect her pregnancy, the baby. There's no current evidence that that is happening. The caveat to all of that being that the evidence, the number of women who became infected with and became COVID-19, having the disease, is small. The largest series that was looked at, meaning doctors looked at a series of women and followed their outcome, was 30 in China. And what they saw was that of the 30 women, 28 of them required delivery by C-section because their COVID-19 disease, meaning the respiratory stuff and probably the heart stuff, was so severe that they needed to deliver the baby to help save mom's life. And so that's one of the things they saw. However, what they also saw is that in none of those women did their babies, when delivered, show signs of infection. These babies did not become infected while in the womb. They did not. So that's really reassuring and good news to hear so far. I keep saying so far because we need more information. Medicine and science is such that we need evidence. We use evidence, and so the evidence currently points to no infection, but we're still being careful, which is if we can avoid mom getting sick, then we can even reduce that question of, is a baby at risk? And that's what's important here. But that's the key thing to know. There's no apparent risk of vertical transmission, meaning if woman becomes pregnant, baby in utero, in womb becomes infected. There's no evidence of that so far. What we do know is some of what we're using from our general knowledge about viruses and pregnancies. In women who are pregnant, we know in particular in the first trimester, if a woman is infected with a viral illness, particularly one that causes her to be very sick, she could then potentially go on to miscarry. And that might be the body's way of trying to help itself, which is it's trying to improve and heal itself from this really bad systemic infection that it may then divert resources. It could be that some immune cells cross the placenta and they're not exactly what are good for pregnancy, so they may stop a pregnancy. Notice I keep saying could be because this is not proven fact. This is a theory. The theory is how that happens, but we know if someone has a systemic, viral, serious, severe infection in the first trimester, one of the risks is miscarriage. So again, if you're someone who's trying to conceive or newly pregnant, it's especially important that you minimize your risk of infection. And likewise for those around you to work to help you minimize becoming infected by practicing safety precautions. Again, we will go over those at the end. So those are things we know. We know that women who have early viral infections in first trimester, if it's a systemic, meaning whole body, something that can make them quite ill. So let's say you were pregnant and developed COVID-19 in the first trimester, you will be followed closely, partly because we're still learning about the disease, but also because we know such of a serious disease in the first trimester can lead to your baby growing very small, or what we call growth restriction. And so you will be followed closely. But again, the goal here is to avoid infection so that we can hopefully avoid those possible outcomes. Stillbirth is a possibility if someone were to become infected. From that group of 30 patients who was followed in China, What the CDC shared today is that of that group of 30, only one had a stillbirth. And so whether or not that stillbirth was truly related to the COVID-19 disease or whether it was related to other things is yet to be determined, but it certainly is cause for concern that I'm mentioning it. So again, these are all the reasons why we want to take coronavirus seriously. It's not because coronavirus infects babies. It's not because it crosses the placenta and infects the pregnancy, but it's because of what it can do to a mom, a woman who's pregnant, particularly someone if she has underlying health issues and diseases that probably already put her at risk. And so again, if you have a history of asthma, particularly if you have severe asthma that's required hospitalization, and worst case, if you've had to be intubated, needed help breathing with a tube for your asthma, you're considered high risk. HIV positive, pregnant, particularly if your HIV is not well controlled. Autoimmune pregnant. For a lot of our autoimmune pregnant patients, we have them on steroids to help suppress the autoimmune disease during pregnancy. So if you're such a patient, you're considered high risk. And so again, those are some of the things to keep in mind. We have small subsets of patients who are pregnant and also on chemotherapy. Again, patients like that. So it's important to know who you are. So that's the first question you should ask yourself is, am I at risk? If I'm at risk, have I taken all the steps? Have I reached out to my doctor? Does my family or my close loved ones, do they know I'm a high risk person to help me? So those are the big things to know. Coronavirus, COVID-19. The difference. And not everyone with coronavirus will have COVID-19. As a matter of fact, the majority of people infected with the virus will not go on to develop COVID-19. However, those who have COVID-19 can go on to have pretty severe symptoms that can lead to pretty bad outcomes, meaning needing hospitalization. If you're pregnant, it may even require delivery of your baby, whether you're full term or not, in attempts and efforts to save your own life. And so it's important to know this today. So those are the big things. Now let's talk about how do you present. So let's say you think, you know what, I've been exposed, I might have been exposed, I think I might have symptoms. Like I said, contact your doctor. But let's get beyond that now. How do we prevent? And so the first thing is to minimize exposure. Like I said, it's spread primarily through droplets. We now know that the droplets can survive on different surfaces for as long as a week, and in some surfaces 3 to 4 hours. So it's important to clean surfaces, clean your hands, clean your face, wear clean clothes, changing your clothes, and then avoiding contact with people as much as you can, and avoiding exposure in big spaces and large groups. And that's what we're talking about here. And so, yes, washing your hands. The recommendation is washing your hands for 20 seconds. At first, 20 seconds sounds short, but in reality, it is not. And so I'm actually going to show you an explanation of what 20 seconds is, because I did it with my staff at the office and they enjoyed it. And so I would teach you that when I learned to count 20 seconds of hand washing, I was taught to do it to the ABC song, because I was told if you can sing your ABCs from start to finish, you're going to be just over 20 seconds, and that is how long you need to wash your hands for. I think it's good to know about it because you can also teach your children. It can be a fun way to say to your younger kids, hey, let's practice your ABCs, because the goal here is also not to instill panic, not to scare your kids and fear, right? One of my nurses shared with me today that one of her kids kept saying, why do you keep putting Purell on me? What's wrong? And so I think we do need to come up with creative ways to help even children not panic. And so one is the ABC song. So let's do it, right? So A, B, C, D, E, F, G, H, I, J, K, L, M, N, O, P, Q, R, S, T, U, V, W, X, Y, and Z, I've sung my ABCs. There goes the 20 seconds. So of course you can finish the song, but it's more to demonstrate that it's a really effective way that was my timer. It's an effective way, and it shows you exactly how long you need to wash your hands for if you're washing. Get it lathered up, soap it up, and wash it for 20 seconds. Sing the ABC song. There are other songs out there that you can sing the choruses to, but certainly if you are English speaking or someone who uses a Romance language alphabet, if you can sing your alphabet in particular, you'll get your 20 seconds. If you're someone listening who speaks a language other than one of the Romance languages that follow that Arabic alphabet, do please tell me a song that we can sing. That's 20 seconds. I would love that. Alma just said that her baby is enjoying hearing me sing. Yes, I don't sing often. I don't try to have talents in my family. I leave that to my mom and my brother, but it's important that we at least have this song to work with. So that's the first thing, clean your hands. If you don't have access to soap and water, use your Purell, your alcohol-based sanitizers. The goal is for them to dry out and kill not just the virus, but bacteria. What we know is when you use those, the optimal way to use them is to use it, get your whole hand between the fingers everywhere, and then allow your hands to dry. So don't touch anything before your hands have dried. Now they're alcohol-based, which means they dry very quickly. So just keep that in mind, but that's what you do. You clean your hands with the sanitizer, the alcohol-based sanitizer, your Purells, etc., and then you wait for them to dry before you touch anything. So with your kiddos, again, you can come up with a quick song where it just says, you don't need more than like 5 to 10 seconds to dry them. Let's just sing, dry our hands. This is how we dry our hands. You say that about 4 times, they're dry. And so it's important to teach them that one. Truth be told, we really should all be washing our hands always, not just because of coronavirus, but because of any viral infection that we can spread, any bacterial infection that we can spread. So let's just practice it and keep doing it, even when the coronavirus fears have abated. Okay, other things, you've heard, avoid touching your face, avoid touching your eyes, your mouth. That's true, and again, it's because if droplets dropped, spread. But another big culprit is cleaning your phones. And so we all use our phones so often, as with reflex, we use the phone and then we touch our mouth, we touch our eyes, we don't even know. A parent, you may be touching stuff and then you touch your kid and you come back to your phone or your iPad. We need to be mindful and clean those things. The recommendation is using Clorox-based or bleach-based cleaner or Lysol. Those have been shown to be effective. I'll place a link at the end here today of those cleaners that you can use. Key thing to know is don't use those cleaners on your own body. Don't use them on your children. Do not drink bleach. That is not true. It does not work. Don't drink ammonia. Honestly, you shouldn't start drinking things now that you wouldn't otherwise have thought to drink. The truth is, they're not going to work, right? They're dangerous. They're poisonous for a reason. And the goal here is to prevent infection or minimize spread of infection, not to harm yourself, obviously. Other things is if you've been infected or you're pretty sure you tested positive or someone around you has tested positive, you should wash your linen, your bed sheets. Some people argue you should also wash your curtains if you have curtains, and really wash them clean. Depending on the colors, if you can use a bleach or a bleach alternative, you should definitely use warm or hot water to help wipe down surfaces. Just follow your usual things that you would do. Wipe down surfaces, clean the bathroom, your countertops, your kitchen, workplaces similarly. So that's important. And lastly, in terms of precautions or planning, a lot of things are getting shut down. Pharmacies are still open, but certainly if you're one of those high-risk patients again, you should make sure you have a stock of your medical supplies. So if you're a diabetic, my recommendation is working on making sure you have somewhere in the order of a 1 month supply minimum of your insulin, your testing supplies. You should really be testing your sugars. One of the things that we've learned in medicine over the years is if someone's blood sugars are not well controlled, infections progress quickly and you have a worse outcome if your sugars are not controlled. So it's really important that you get into the habit, if you're not already, of testing your blood sugars and keeping them within the range that your doctors have looked for. If you know your diet has not changed, your medicines haven't changed, you are following your medicines accordingly, and you start noticing that your sugars are really out of whack, they're really high when they shouldn't be, contact your doctor's office just in case there might be an infection you're fighting off and you don't know. So that's important to look for. But get your supplies, get your testing supplies, if you're autoimmune disease, etc., because with things getting shut down, what we call supply chain may change and some things may become less available. Hopefully not, but prepare, right? So those are things to keep in mind. Okay, I'm going to work my way through the questions here. I thank everyone for their patience. We're at 42 minutes at this time. So let's work our way through the questions here. So Lisa Marie said, hey Cindy. Hi Lisa, how are things in Denmark? Hello. Ligia, yes, share what you know. Lots of hysteria everywhere, especially here in Ontario. I'm sorry to hear that. I think, some of the hysteria is real, but I think the rest of it is as a result of misinformation or not enough information. And so I hope that tonight I'm able to help give more information. Hi Amy, Sarah Lee, Joelle. For Savitri say, watching from Trinidad, thanks for explaining, doctor, because many people are not understanding. Again, I hope people are getting more of an understanding here. That's my hope. From Heidi, watching from Tobago, thank you for sharing the information, Dr. Duke, and simplifying it for all to understand. That's my goal. I really think there's a lot to pass through. There's a lot of scary stuff out there, so this is what we're doing. And Alicia says, hello, Dr. Duke, watching from Thailand. Hi, that's awesome. Nice to see you, Alicia. Brenda Pierre, watching from Trinidad. Trinidad just reported their first case of a person testing positive for the coronavirus. What I want to tell everyone in Trinidad, here in the United States, here in Las Vegas, is to remember, someone testing positive for coronavirus does not mean they have COVID-19. Okay, so that's the first thing to remember. Hearing that someone tested positive does not equal, oh my God, now that person's in the intensive care unit. We actually hope and pray that they're not. But hearing that someone's tested positive, given how easy it is for the virus to shed and droplets to spread, we should then take it seriously enough to know if we weren't following and implementing precautions before, we should now, so that we can help protect those in our communities that are vulnerable and at high risk, okay? Odette George, watching from Trinidad. Admiral, thanks for watching from Tobago. Sierra, non-emergent surgeries be canceled in the future? That's a good question. So she's asking, will non-emergent surgeries be canceled? At this time, non-emergent surgeries have not been canceled by hospitals. Certainly at my clinic, most of the procedures we do are non-emergent. To my patients, they feel urgent, I know, but they're non-emergent. At this time, we have not canceled our elective procedures like egg retrievals, embryo transfers, or plans for surgeries. But what we have done is we've implemented a number of safety protocols, including calling patients the night before their visits, the day before, to screen them for symptoms and also to explain if they were to develop symptoms from the time we've called to the time of their scheduled appointment to reschedule. We've offered patients who are planning to have surgery or egg retrieval cycle started to delay one cycle or two so that if they prefer, they can wait. I've explained very clearly that if someone were in cycle and developed symptoms of the virus, we would have to cancel cycle, meaning stop the treatment until they're better, until their quarantine phase is over, etc. And so we've made that clear to patients and given them the option. We've also, for those who maybe are high risk and do not want to come in for an appointment in person, we have made it available that you can do telemedicine appointments with me via phone video consultation. We have that available. You can call us at 702-936-8710. We've made that available. But short answer, Sierra, is we have not canceled any non-emergent surgeries at this time. We're all watching the situation. It's certainly one that's changing in real time, and we may change that as things progress, but for right now, we have not. We've just implemented protocols. We've restricted children visiting the clinic. We've restricted people who are not patients from entering the clinic for right now. And that's all aimed at minimizing exposure to protect our patients, our newly pregnant moms, and our staff, because some of my staff are also pregnant. Julia Brown, locked in. Hi, Julia. Alma, that's the baby was singing. Kel says thank you. Jessica Urbanski, would or could this affect my upcoming embryo transfer? At this time, it does not, Jessica. However, we have been reaching out to patients to offer, like I mentioned, opportunities to reschedule. I think while I cannot speak for other clinics or other doctors, I think if you're here listening to me and you're a patient at another clinic, my recommendation would be to contact your clinic to find out what are they doing, what's their plan for you, and what are their recommendations. But that's what we're doing at Nevada Fertility. Kels Lewis says, wow, I didn't know that. Racine Melville, my FA made me have a meltdown yesterday when she told us everyone is going to get it. Thanks for sharing your knowledge. A lot of us are going to get it. You know, the estimates are that somewhere between half of the population to as much as 2/3 or 3/4 of the population will become infected. But like I said, infection does not mean disease. And so it's very infectious. Yes, people will get infected, but the majority of us will have mild or no symptoms. And so what we're actually talking about is protecting the ones who will have worse presentation, who go on to develop COVID-19 disease. Cindy, hey chick, good night, nice to see you. Nice to see you, Cindy. Kellyanne Williams, thanks Doc, calling from Tobago, nice. Watching from Antigua, hi Wendy. Mel's Melvin, Canadian Prime Minister's wife, just tested positive. Thanks for all your tips. Yes, Sophie Trudeau, I'm a follower of Prime Minister Trudeau. And yeah, she tested positive, and so he announced that he was putting himself in self-quarantine, which is very smart. And it's certainly what we should all do if we were exposed or in close contact with someone who tested positive. We should go into quarantine. Now, the quarantine period is 14 days, and that's because it can take up to 14 days for someone who was exposed, infected, to actually show symptoms if they're going to. And like I said, even if you don't show symptoms, you could be shedding virus. So if you're like, oh, I feel fine, I was exposed, but I'm doing fine, I'm strong, I'm healthy, like an ox, you might actually be saying all that and transmitting the virus at the same time. So keep that in mind and stay home if you can. I actually shouldn't say if you can't, stay home. Right? I know for a lot of people, one of the things we've talked about amongst my staff and amongst friends and contacts is they don't exactly have paid leave. And so the concern is, what am I going to do if I don't work? I need to feed my family, I need to keep housing, I need to keep my car, etc. And so I think there are a lot of people coming up with programs to help, because this is real. And if we're to help others, that's what we're going to need to do. Alma says, going off of Sierra's question, would it be too risky to go into a hospital for a procedure that could wait, especially since the hospitals aren't sharing where the patients with the virus are at? I would would tell you what I know of the hospitals in which I operate at, what they're doing. And so they're actually screening. One hospital in particular that I go to very often, they actually have people standing outside of the hospital, physically standing at the entry points of the hospital, asking screening questions to determine if someone has any symptoms before they enter the hospital. That's the first thing they're doing. If someone has symptoms, they're quickly triaging and getting them to testing without walking them through common spaces in the hospital. The thing is, for a lot of hospitals and surgical facilities with outpatient surgery, which is what you're asking about, same-day surgery, they have separate entrances for their outpatient facilities, and they do follow different protocols. Certainly, they ask these very questions right away to help isolate you. So no, my answer at this point is there doesn't seem to be any specific reason to avoid hospitals altogether if you have a scheduled surgery. I would tell you that what's nice and what you should know and take comfort in is hospitals have prepared for pandemics from day one. Every year they prepare for a flu pandemic. Every year, without you knowing, the hospitals are preparing for infections and things that could do this. Now, coronavirus is not influenza, it's not flu, admittedly, but some of the things that we've learned from the flu and flu preparedness is being applied in the same way. And so many hospitals have these things in place. They usually have public health and epidemiology departments designed just for this. And so I think you can take some confidence and comfort in knowing that. Sarah Lee, loving your presentation, very informative. Thank you so much, Sarah. I thank you guys for your attention. I know it was a fairly long one. I tried to hold these to 30 minutes, but we needed to cover a lot today. We talked about coronavirus, what coronavirus is and why it's different from the disease that an infection of coronavirus can cause, which is COVID-19. We talked about how to distinguish what can happen with an infection and when you should be worried and what symptoms are. We talked about how to prevent spread. We talked about the messaging. And so the messaging really is to reassure you that this is not the zombie apocalypse. We're not all going to die. Most of us are actually going to be just fine. However, are we really fine if we're spreading it and harming the others who are not able to fight off an infection like this? And that's really what we're talking about. I'm here to tell you that people are working very hard to find the answers. I'm here to also tell you, though, not to have a false sense of security. I can say, I'm going to speak this now, but as a woman of color, a Black woman, I know a lot of people that I've talked to anecdotally are comforted by the news that says Africa doesn't have coronavirus. Now, there is coronavirus on the continent of Africa. It's not in every country. There are 55 countries in Africa. So far, 12 countries have people who've tested positive. The people who've tested positive, some of them are Africans who travel to Europe and have come back with the virus. So yes, but it doesn't mean Black people cannot get coronavirus. So I don't want someone who's sitting at home, who's Black, African American with underlying illness, underlying immunocompromised state, assuming that the news is good and just be laissez-faire about it. Take it seriously, protect yourself, follow the safety protocols. If you're someone who has a family member who's sick, take it seriously and protect them. Don't just say, you know what, I'm protected, we're good. We're not sure. This disease is progressing. So far, we don't have enough data to say that it's race specific or genetics do this or that. Maybe in a year or 2 years, we'll have that information. We do not have that right now. Do not go into a sense of false security. Do not spread misinformation that tells others that they're safe because they're a certain race, a certain ethnicity, or because they clean their houses differently. We should all take precautions because we're not just protecting ourselves. We're protecting our loved ones. We're protecting our co-workers. We're protecting those people we may just pass by on the street. This is a public health campaign to protect everyone that we can. So let's remember that. Melville, another question. Do you know if they have determined whether or not people that may have recovered from the disease are building antibodies? They're still working on that. They seem to be. What we don't know yet is how lasting the antibodies are, but certainly people are looking at all that. What's important to know, though, is that with viruses, it's not just antibodies that we look for helping to fight off viruses. Now, full disclosure, so everybody knows, I have a PhD. My PhD is in microbiology and immunology, focus on virology. I spent 4 years studying viruses and how to manipulate the human immune response to viruses. So I'm speaking not just from a place as a physician, but as someone who did work on this specific question that I'm answering here for Melville. And so viruses require not just antibodies to fight them, but they require what we call T cells. Your lymphocytes have to fight them off. So someone may have antibodies to a virus, but still be infected by the virus and have really bad outcomes from the virus because their body is not fighting it off. It's just remembering what it looks like. This happens to be the case with, for example, HIV. People who are infected with HIV have antibodies to HIV. That's not the problem. It's that HIV is actually working on T cells and lymphocytes, which are the things that are supposed to fight your viruses in your body. It's why when we look at the labs, right, a person with a viral infection tends to have a normal white blood cell count because it's not your white blood cells per se that fight off a viral infection, it's your lymphocytes, your T cells. And so that's the sort of thing to know. Andreen White, do you think traveling on a taxi is risky at this time? I think traveling in any public transport has some risks, and that's because you don't know who was in the seat before you, who's sitting next to you, if it's a shared vehicle. As someone who grew up in the Caribbean, I know that taxis are not in the sense what we know in the United States. Most taxis are like a shared Uber. In the Caribbean and many of the parts of the world and third world is you share the taxi with other people. So it's part of why we talk about social distancing, which is if you don't have to go somewhere, stay home. And that's again because you're trying to minimize exposure, because you may be the person sitting next to someone in a taxi and you just spread something to them and vice versa. One of you may be immunocompromised and not know it and spread things. So again, that's the reason. It's telling you to stay off the streets, avoid public transportation when you can, stay home, self-quarantine, clean, wipe down surfaces. If you cough into your elbow. If you use the bathroom, clean your hands, and you should be cleaning your hands for 1 or 2, whether you do number 1 or number 2. Joanne Cummings, good night, Dr. Duke. Good night, Joanne. And Melville says thank you. So I think if there are no other comments or questions, I will bid you guys good night. Thank you so much. Thank you for your patience because our initial broadcast didn't work out like we expected. If you have questions, feel free to write them here or send me a message. You can also email me at, this is where you can email. You can email me at info@drcindyduke.com. I will gladly answer your questions from there. I will have this video posted to my Instagram later, a link to my Twitter, and also I will have it up on my website, which is drcindyduke.com. It will also be on the Nevada Fertility Institute Facebook page and website, and the Facebook page for the Trinidad and Tobago Center for Comprehensive Women's Health. Guys, again, I want to leave you with don't panic. Be good to yourself. Be good to each other. Viruses do not know race. They do not know color. This is not a foreign virus. It's not a Chinese virus. It is a virus. All viruses behave like this. This is how they work. And some of them are more infectious, meaning they transmit quickly. And so now we need to do our part to minimize and stop the rapid transmission. Good night.